Thanks for staying tuned. This is still IBrandTV, and it's time to delve into the topical issue of the day. It's all about the monkeypox plague that has ravaged several parts of the world, including Africa, and we're looking at the symptoms as well as the preventive measures. And join us to discuss this, Bola,
Yes, Dr. Tui Mebawodu. He is a public health practitioner, and of course he would be talking to us extensively on what monkeypox is, the preventive measures, and of course how to deal with this pandemic, or rather this epidemic that is ravaging different parts of the world. Thank you so much for joining us, Dr. Tui Mebawodu.
Good morning. Thank you for having me.
Good morning to you.
Hear me clearly?
Yes, we can.
Yeah, good morning.
So talk to us about monkeypox. Research shows that it was actually first discovered in 1958, and that was in Denmark, amongst some monkeys that were used for research purposes. But it looks like all eyes are turned towards Africa when when you talk about the disease. Can you help us make sense of this?
It was actually in the laboratory virus that was discovered in one of their laboratory animals, sometimes in 1958 in the DR Congo. But it wasn't until 1970 that the disease was seen in a child in the same DR Congo. It's a zoonotic disease. That means a disease that we pick from animal, and then it comes with a rash, fever, headache, body ache, sore throat, intense weakness, and a rash. The rash is actually, you start flat, then there's water inside it, it becomes pores, then it bursts, and then it falls off. The incubation period is usually between 6 days and 21 days, can be a bit earlier. And then, like I said, it's transmitted from first of all from animal to human, and then from human to human through very close contact. There are two types of monkeypox. There's one that we see in West Africa, and there's one we see in DR Congo. So the West Africa one is a bit mild in fatality. The DR Congo is a bit more. People that have compromised immune system, children and pregnant women, are more likely to have a severe form of the monkeypox. But generally, this is a mild disease, and then, milder than smallpox, but it's not a thing that should cause panic in the world. But what we have seen recently is the spread of the monkeypox, or even the occurrence of the monkeypox in places where ordinarily they've never had the disease before. We've seen many countries in Europe, Australia, Canada, and America coming down with monkeypox. People there coming down with monkeypox, especially among men having sex with men. So then they ask a critical question: where did they get this disease? And these people, they have not traveled to any of the endemic countries, so the question is now, where did they get the monkeypox? Now, it comes from scientific reflection and research to understand another dimension of the transmission of disease. Yes, of course, our main fear is not the disease per se, but the fact that are we seeing a mutant of a virus becoming a monkeypox? Are we seeing a new mode of transmission of the disease? What's our response? And especially in Nigeria, where we've had quite a number of monkeypox, more than 3,000 cases, since 2017. This year alone, we've had more than 500 cases. And this month.
Okay, Dr. Tui, before we go any further, maybe we should talk about the predisposing factors that lead to monkeypox.
Now, we know that in this environment, there's in the world now, there's climate change. Okay, we are constantly coming with animals. We're felling trees. We're getting closer to the pests. So that will be a predisposing factor. Usually from rodents, from animals, from even domesticated animals.
Okay, talking about the predisposing factors
yes.
to monkeypox. It is one disease which, of course, about 6 cases have been reported in Nigeria.
And, you know, the thing is, the symptoms are striking, you know, fever-like. So sometimes, especially in this part of the world where we do not take regular checkup, medical checkup seriously, there's always the sense that you could just, dispel the symptoms as, oh, the regular malaria.
Dr. T is back with us. Dr. T, so you were talking about the predisposing factors.
Yes, can you hear me? Yes.
Go ahead.
I've said that, yes, animals, you know, of course, close contact with animals. As we're building residents, as we're felling trees, so we get close contact with some of these animals. Then the second predisposing factor is like weak immune system. If your immune system is weak, you are predisposed to those germs. Okay. And if you're a child or a pregnant woman, you are a pregnant woman, so you are disposed to this. People that stay too close to themselves, you know, overcrowding, poor hygiene. Okay. These are all the factors that, you know, make one to be predisposed to the infection. And then if you travel to the endemic places, okay, it's endemic in West Africa, it's endemic in Central Africa. So these are some of the factors, because even if you look at it, the May 7th outbreak that happened in Canada was in somebody that traveled from Nigeria to Canada. So even the first case that they saw in the US in around 2013 was from a pet imported from Ghana. So these are factors that can lead to the spread of monkeypox. But what we're seeing now, the new information that is seen commonly amongst men having sex with men, becomes something to really research and look at. It is not a sexually transmitted disease, but of course, the sexual exposure gives very close contact with a person, like a change of body fluid, kissing, touching, and of course, the react. These are actually what allows the monkeypox to spread among men having sex with men.
Okay, doctor, let's look at, you know, the symptoms. What are symptoms of monkeypox and how can we identify them basically?
The symptoms are they are constitutional symptoms first before the rash. Fever, headache, sore throat, body ache, intense tiredness, swelling of the lymph nodes. Swelling of the lymph nodes. And then all these things will happen. Usually about 3 days after the rash will appear. The rash starts from the face and then spread down, okay, to the trunks, then to the arms. The rash is actually bigger, far bigger than that of the smallpox. And the rashes usually have water in it, which the water becomes pus, and then which can then break. Within 2 to 4 weeks, the cycle is complete, and then hopefully the person recovers if the fertility rate is not bad. Okay,
so within the first symptom, talking about fever, headaches, and what have you, or sore throat, to the fertility stage you just mentioned, that's 4 weeks.
Yes, 4. I said by the time the fever is coming up.
Okay.
Within the next.
Okay, so that sounds like sometimes it doesn't even need treatment for it to go. It just completes its cycle and then it
leaves.
goes.
That's if, you know, the fertility is not rampant all over the body. Again, I was trying to get his thoughts. Is from the first symptom of headache or fever to the outbreak of the rashes up from the face to the other parts of the body. I think that's the 4 week span he's talking about. Doctor?
Yeah, I can hear you.
Oh, okay. You have the floor, sir. My question was, the span you talked about, the fertility and all of that. I'm saying from the very first symptom that appears, be it fever or headache or sore throat, to the outbreak of the rashes from the face to other parts of the body. Is that the 4 weeks window you're talking about?
Yes, every 2 years, between 2 to 4 weeks, yes.
Wow.
So are you saying that sometimes it doesn't require treatment? Once it completes its cycle, then it goes?
Again, because, yes, you have to treat the constitutional symptoms so that because there's what we call secondary bacterial infection, which can then affect some other organs in the body. So, in a way, there's no way you have fever, sore throat, intense body ache, and you not try to treat at least constitutionally or symptomatically. Yes, there are some antibiotics that can actually, you know, antiviral agent that can actually be applied.
Yeah.
But what we know is that the rashes, because it can disfigure the skin, we also need some some basic care. Then the thing is that, of course, there are vaccines that could help a bit, but how much of those vaccines do we have in this part of the world? Which is smallpox vaccine. How even effective do we know? Because 1970, 71, we eradicated smallpox. So well, we don't know how effective the vaccine is going to be now. So the best we can do is actually to figure out how we can prevent, how we can ensure that we don't get disease, how to do surveillance.
All right, before we move to prevention, Doctor, I'd like to bring to your notice that the fact that about 15 cases have been recorded in Nigeria. Lagos and Adamawa have the highest cases of 3 each. What do you think is responsible for this high rate in Lagos and Adamawa? Are there some environmental factors responsible for this? Dr. Tuyi? Okay, we've lost
we'll probably get connection with him later, but that's a very vital question, so that we all can be on guard.
Exactly, Lagos and Adamawa, and then we have about 7 states that have recorded cases of this infection.
The biggest concern, that's not to disregard the concern of other citizens everywhere, will probably be Lagos, and that's because of how overpopulated Lagos is. And the doctor has just told us that overcrowded.
Okay, Dr. T is back. Okay.
Hello.
Thank you for joining us again, Dr. T.
Yes. Yeah, Lagos and Abuja,
Adamawa.
Lagos and Adamawa, it could one be because, Adamawa is actually a very...
Okay.
The network is not friendly. But my fear for Lagos is, how overpopulated it is. You have people, the houses, people in certain quarters, you have 6, 7 people staying in one room or one apartment. And that overcrowding, he talked about it.
Lagos has this characteristics of, 1, welcoming everybody from every part of Nigeria into it. Yes. 2, being overcrowded. 3, poor disease surveillance, and these are factors in the spread of the diseases. Of course, overcrowding is key, and then varied population coming from other parts of Nigeria will actually make Lagos case a bit precarious. Yeah. Now, Adamawa State is an agrarian community with a lot of mountains, a lot of and then, of course, with a lot of people roaming inside the bush, could be another factor. What could also be a factor of detecting those things could be the fact that, because